Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Hafide, and welcome back to our Healthy Living edition of KUM News Extra. If you are just joining us in studio, is Dr. Jitka Lom from Express Care, located in the Agana Shopping Center. We are talking about hypertension, and now we are taking your questions. And our first question is from Jeff from Mangilau. He asks, what is considered a normal blood pressure rate and what is considered high?
That's good. Yes, normal blood pressure for an adult would be 120/80. Now those numbers, there's a top number and a bottom number. Now when your heart pumps, it squeezes out the blood. That's the top number. It's like a wave. You'll see the crest of the wave. Then the heart relaxes to fill up with more blood. That's the bottom trough of the wave. So we measure the top and the bottom of the wave of the blood pressure, and the top number 120 and the bottom number 80. So once it creeps up to 140/90, then you're talking about hypertension or high blood pressure. Between the 120 and the 140, you sort of have a no man's land where it might be okay depending on the age and the health of the individual, but you should aim for 120/80.
Our next question is from Anna T. She asks, my parents both died of heart attacks related to hypertension. Does this mean me and my siblings are at greater risk for developing the same conditions?
Definitely. Actually, the numbers are pretty scary. If you have both parents that have high blood pressure, your risk is 30 times another person who doesn't have that risk factor, of 30 times the risk of developing high blood pressure by the age of 35. So you will be at risk for it at a young age.
Our next question is from Jen L. She writes, I'm 7 months pregnant, and at my last 2 doctor appointments, my blood pressure was high, and they are now monitoring me for preeclampsia. Did I say that right? Preeclampsia. Is this a serious problem?
Yes. Preeclampsia is a condition of high blood pressure in pregnancy after the 20th week of pregnancy. And it's quite, it's not uncommon. Let's say about 8% of pregnancies will develop that. And along with the high blood pressure, the woman will also develop swelling, and she may be spilling protein in her urine. And it's very important that the condition be controlled, because if preeclampsia is not controlled, it leads to eclampsia, which means seizures, eventually leading to coma and death. So it's a life-threatening condition if it's not controlled. It can be controlled, but the only real cure is having the baby. So once the mother develops it, she must usually be on bed rest and sometimes be on medication as well to control her blood pressure until such time as it's safe to deliver the child.
Our next question is from Dave from Agana Heights. He writes, I was prescribed 2 medications, diuretics for my hypertension, and often get dizzy spells now. Could this be from the medication or from the high blood pressure itself?
That's a really great question. You know, there are so many medications for high blood pressure out there. The fact that Dave is experiencing some side effects should lead him back to the doctor to check and see. Maybe his blood pressure has been lowered too much, and that's why he's getting dizzy. Or maybe it's simply from the actual medicine that he's taking. Or on the other hand, maybe he's still way out of control and he's getting dizzy because he's about to have a stroke. So he needs to find out which of those 3 possibilities there are, and also to understand that when we are treating high blood pressure, sometimes there's a bit of trial and error involved, meaning you start with one medication, you try it, see how it goes, come back for a follow-up and make sure that things are going well, if not switch to a different medication.
Our final question is from Molly Ann. This was sent to us via Facebook. I'm taking lisinopril,
right?
Like 20 milligrams,
20 milligrams, yeah.
But still feel the same as before I was prescribed, eager and irritable. Should I change medications?
Right. So that's a great question. Again, depends on what her numbers are now, whether it's come down to normal or not. If the numbers are not normal, then she could just increase the dose, and lisinopril goes up to 80 milligrams per day. You can take that. So usually I will try to increase the medicine rather than switching, but sometimes it's also necessary to switch. And in the end, you should be taking a medicine that gives you no side effects and that you feel completely fine.
Thank you, Dr. Lom, for joining us this evening and taking questions from our viewers. Dr. Lom, of course, will be here again next week for another edition of Healthy Living. Next Tuesday, we will be talking about sleep problems, including jet lag and insomnia. If you've got questions, post them on Facebook, Twitter, or log on to KUAM.com.